A groundbreaking approach to eradicating Parkinson's disease is emerging, one that starts at your doorstep. Imagine a world where a condition once seen as an unavoidable part of aging could be wiped out through simple, everyday choices, like the way you clean your home, what you eat, or even the air you breathe. This is the vision of neurologists Dorsey and Okun, who argue that Parkinson's isn't just a genetic lottery, but a preventable crisis driven by our polluted environment. Their book, The Parkinson's Plan, challenges everything we thought we knew about the disease, and it's time to rethink how we fight it. When my grandfather was diagnosed with Parkinson's in 2014, I saw it as a cruel twist of fate. His hands shook uncontrollably, his movements slowed, and he lost weight so quickly it felt like his body was being drained. But after reading The Parkinson's Plan, I realized this wasn't just a personal tragedy. It was a public health emergency. The book reveals that over 85% of Parkinson's cases are linked to environmental toxins, not genetics. Pesticides, industrial chemicals, and even air pollution are now central to the disease's rise, and the evidence is staggering. Studies show exposure to these substances can increase Parkinson's risk by up to 500%. It's a revelation that's been quietly waiting to be heard for decades. But here's where it gets controversial. Yet, despite this knowledge, many of us are still unaware of how much we're exposed to these dangers. The book's Parkinson's 25 checklist offers a roadmap to reduce risk. Simple steps like using water filters, avoiding well water, and drinking caffeinated coffee are backed by science. But the real game changer is the call for systemic change. Doctors Dorsey and Okun argue that we must ban harmful chemicals like paraquat and trichloroethylene, which are linked to Parkinson's, and invest $3 billion in research to find safer alternatives. They also stress the need for transparency. People should know if their homes or schools are near contaminated sites or pesticide-sprayed areas. This isn't just about individual responsibility. It's about holding corporations and governments accountable. And this is the part most people miss: the political battle for Parkinson's prevention. Current efforts to cut disease research funding and weaken environmental protections threaten progress. Yet, Dr. Okun sees opportunity in the chaos. He points to the recent Make America Healthy Again report, which highlights the need to regulate chemicals and pesticides. When you have a chance to get rid of a disease, you have to take it, Dr. Dorsey says. We've done it with HIV, we can do it with Parkinson's. So, what's the takeaway? Is the solution in our hands or in the hands of those in power? Are we simply bystanders in this crisis? Or can we become advocates for change? The answer lies in the choices we make today, whether it's choosing cleaner air, supporting research, or demanding accountability. After all, Parkinson's isn't just a disease of the brain, it's a disease of the planet. And if we don't act, it may be too late.